Hi everyone, thanks for tuning in today. This is the first of two videos we have created to share information about health and wellness and resources to support health and wellness with members of the Homewood community. In this video, we will be talking about mental health, specifically focusing on depression. Our goal is to provide members of the Homewood community with information about the services offered in their area in the hopes of increasing awareness and utilization of resources that can help residents be healthy and, most importantly, be successful in doing the things that are important to them. To start off, we'd like to take a moment to introduce you to our team.
Hi everyone, my name is Sarah. I'm a second-year occupational therapy student at the University of Pittsburgh.
Hi, my name's Emily. I'm also a second-year occupational therapy student at the University of Pittsburgh.
Hi everyone, my name is Leah DeLion and I'm a second-year occupational therapy student at the University of Pittsburgh.
According to the World Health Organization, mental health is defined as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her own community. Mental health affects individuals no matter what stage of life, from childhood and adolescence to adulthood. Mental health can manifest in many ways. It can manifest emotionally, such as with mood swings or depression. It can manifest psychologically, such as in thought processing and decision making, or it can manifest socially, such as in relationships with friends and family. There is a direct link between mental and physical health. People living with mental illness are more likely to experience chronic physical conditions and vice versa. So, what does mental health look like in today's world? These statistics were published by the World Health Organization in 2020 in regards to mental health. 450 million people are currently suffering from a mental illness. 1 in 4 Americans currently suffer from at least one mental illness, and around 9.5% of U.S. citizens above 18 years old encounter a depressive illness every year. These statistics are alarming and highlight the prevalence that mental health issues have on our country. The pandemic going on can cause a lot of strain and affect mental health greatly. There are many ways that the pandemic can impact mental health, but a few are listed here. Because of the rapid growth of the virus, it can be easy to become anxious and fear getting sick with the virus. Stress can have an impact on mental health in various ways, in relation to income, loss of jobs, loss of family members, etc. And finally, the pandemic has had an effect on social interaction due to the quarantine and shutdowns throughout the country. Social engagement is crucial to have in daily life to improve mental health. The graph on the right highlights some statistics regarding mental health during the pandemic, specifically in the month of June. The resource is listed underneath if you are interested in taking a deeper look.
Partners for a Healthy Community is a collaboration between the Homewood community and the University of Pittsburgh. In 2018, they collected a wide range of information from the community by attending fairs, block parties, and community meetings. Some of the information they collected was health-related. Through conversations and surveys, it was discovered that depression was the third most prevalent condition out of 20 total conditions that affects this community. From one survey, it was discovered that 23% of people who responded reported having mild, moderate, or severe depression. Looking at this graph, you can see that almost half of the people fell in the age range between 18 and 39 years old. For many people, these are formative years, and the impact of our health during this time can have a strong influence on the rest of our life.
It is important to know and be aware of the warning signs of depression. If you or a loved one are experiencing any of these symptoms, you could be suffering from depression and should seek professional help if possible. Some signs that are worth mentioning include depressed mood all day, every day, not having any energy to do activities you normally enjoy doing, feelings of worthlessness or guilt, having a hard time concentrating, feeling at a loss of control over your life and your future, and finally, one of the more serious signs is thoughts of death or ending your life. It is possible that depression and other mental illnesses can occur for long periods of time and can progress to a point of self-harm. Here are some of the noteworthy signs that you or someone you care about are contemplating suicide. Talking about wanting to die or kill themselves. Exploring ways to commit the act. Expressing feelings of hopelessness and having no purpose. Expressing feelings of being a burden to others. Increased substance use, withdrawing themselves, and displaying extreme mood swings. If you notice these signs in someone you are close to, they may be severely struggling, and you may want to seek help on their behalf from a professional.
Risk factors. There are many risk factors for depression and anxiety that people of color, especially Black and Hispanic people, face regularly. Some of the most common factors are having been subject to racism or discrimination due to race or ethnicity, lack of access to health insurance or proper health care, live in an inner city or highly developed area, don't have access to doctors that represent their community, have limited access to healthy foods, exposure to violence or homelessness, are from a lower socioeconomic status, do not get enough exercise or don't have access to safe outdoor areas for exercise, have experienced chronic stress as a child or adult, or engage in cigarette smoking, drug use, or binge drinking. Changes and self-advocacy. Some steps and changes that African Americans and people of color can take to decrease chances of developing depression and improving mental health outcomes are: if you do not have outdoor space, you can do things like yoga, dancing, and easy workouts at home with household objects. You can find healthy and affordable ways to cope with stress, like journaling, meditation, drawing, and other hobbies. You can join support groups of similar communities, especially on Facebook, Twitter, and Instagram. If you are white, you can use this opportunity to speak up, advocate, and offer information that you have. Lastly, these communities can advocate for themselves and their community. Call legislators, call healthcare networks to improve access and quality of healthcare in their area. Growth as a community. Many Black communities suffer from mental health exacerbations due to shame and stigma associated with having a mental health disorder or crisis. Lack of discussion on the subject causes many to think that mental illness or a mental health disorder is a personal weakness or a form of punishment. This has dangerous implications for individuals suffering from mental illness within the community. This can also lead to trouble recognizing the signs and symptoms of a mental health disorder/mental illness. This can ultimately manifest as reduced recognition of having a mental illness and seeking adequate treatment and alleviation of symptoms. The sooner struggles in mental health are addressed, the better the outcomes. As communities identify and work towards improved treatment and identification of mental health disorders, they will experience benefits within the community for all. A very important way to address this topic is to facilitate discussions and work to change the community understanding of mental health and reduce the stigma of seeking help. It is beneficial for families within this community to understand that mental health is just as important as physical health, and treating the mind is no different than treating the body. Educate friends and family that one cannot have good physical health without good mental health, and vice versa.
It's easy to ask the question, "How are you doing?" But it's not always an easy question to answer. You may be having the greatest or worst day, and depending on the setting and who's asking, you may or may not choose to go into detail about how you're really feeling. Here are some alternatives to "How are you?" that you can use to connect with people and let them know you're there. Ask if they're free for coffee this week. Share a funny video. Ask if they'd like to go for a walk. Share a funny memory you have with them. Give them a call. Send them an interesting article to read. Pittsburgh is host to a number of affordable mental health resources, many of which are local to the Homewood community. Most clinics do not require patients to have insurance, and some clinics offer their services for free or on a sliding scale. A sliding scale means that the cost of services depends on other factors like income. If you have a low income or don't have extra money for personal expenses, like seeing a doctor, you are charged less but receive the same level of care. UPMC Resolve Crisis Network is located on North Braddock Avenue. They offer free walk-in counseling services to anyone in need. Alma Illyrie Health Center is another resource in the community, providing services on a sliding scale. They provide resources for the homeless population of Pittsburgh, complete standard checkups and treatments, prescribe medications, and provide care for people with mental health and substance abuse disorders. The Sojourner House is exclusively for women and children. They offer drug and alcohol rehabilitation as well as long-term and supportive housing for women and their dependent children. On Center Avenue, you can find the Eye Health Clinic run by Dr. Timothy Wong. This is a direct access primary care clinic. The cost starts at $35 for a visit, and you do not need insurance to be seen by the doctor or prescribed medications. They also help patients find access to affordable testing and medications, even if you already have insurance. Allegheny County provides free mental health screening, which you can access on their website. They also include a Where to Call booklet if you're not sure where to seek help for you or a loved one. Sometimes the biggest barrier to seeing a healthcare professional is figuring out how to get there. If you happen to be an adult older than 65, you are eligible for a free Port Authority bus pass in Pittsburgh. This includes the inclines as well as the T. If you are not older than 65 but are disabled, you can apply for a reduced fare bus pass. This process involves filling out an application with your doctor, as well as having them write a letter on your behalf. The process is shorter if you're a Medicare recipient. You can mail in your application or drop it off in person. You may also be familiar with rideshare services like Uber and Lyft, and you may have also heard of Access. Access is a door-to-door ride service that brings people to and from doctor's appointments. Prices vary depending on the distance traveled. You can find more information about all of these services on our resources handout. Even with these programs in place, it can still be difficult to get to and from appointments. Ask your friends, families, and neighbors for help if you need it. And if you have a vehicle and the ability to help one of your friends or neighbors, let them know.